Maddie, I'm going to be your nurse today doing your head, eyes, ears, nose, and throat exam. Can I get your name and date of birth?
Ava Tatuli, June 23rd, 2005.
Perfect, that matches your wristband. I'm just going to do some hand hygiene. Okay, so we're going to start off with the exam of the head, face, and neck. I'm just going to start by inspecting your facial features, which I see they're symmetric and present bilaterally. Your eyebrows are evenly distributed. Your eyelashes are protruding and evenly distributed. Is it okay if I touch your head now?
Mm-hmm.
I'm just going to palpate the scalp, and it's normal cephalic, round, smooth, symmetric, and there's no lumps. Now I'm going to palpate your sinuses. Do you feel any pain?
No.
No frontal sinus pain. Any pain?
No.
No maxillary sinus pain. Now I'm going to feel your TMJs. Can you open and close your mouth? Great, smooth and no clicking. Now can you bite down? Cranial nerve 5, trigeminal is intact. Motor. Now can you close your eyes and tell me when you feel the cotton ball on your face?
I feel it. Feel it. Feel it.
Great, cranial nerve 5, sensory is intact. Now can you close your eyes really tight and raise your eyebrows and smile, frown, protrude your lips, puff your cheeks. Great, cranial nerve 7, facial is intact. Now I'm just going to palpate your temporal arteries. They're soft, not tender. Now I'm going to listen to your temporal arteries with the bell of my stethoscope. No bruise noted. Great, no bruise noted. Now we're going to move on to the inspecting the neck. So I see that your trachea is midline. There's no bulging or distensions of veins, and there's no deviations. So now I'm going to palpate your thyroid. Is it okay if I touch your neck?
Mm-hmm.
Great, can you just look that way for me? No nodules or enlargement, and you can look the other way. Great, no nodules or enlargement. Now I'm going to feel and check your lymph nodes. There's the preauricular, postauricular, occipital, tonsillar, submandible, submental, superficial cervical, deep cervical chain, posterior cervical, and can you shrug your shoulders for me? And supraclavicular. Great, so no lymphadenopathy noted. Now I'm going to test cranial nerve 11, spinal accessory. Can you just push against my hands? Great, and push against my hand. Great, cranial nerve 11, spinal accessory is intact. So now we're going to move on to the nose, mouth, and throat exam. I'm just going to do some hand hygiene and put some gloves on. Okay. Sorry about that. So, like I said, sorry, these gloves are sticky. So we're going to do the nose, mouth, and throat exam. I'm just going to start by inspecting. So I see that your nose is center, midline, and it's proportional to your face. Now I'm just going to feel it. Do you have any pain?
No.
Great, no pain noted. Now I'm going to grab my pen light, and can you just look up for me? And inspect the inner nares. I see your turbinates are not swelled up. Your septum is midline and no perforations. And your mucosa is red and smooth and moist. so now I'm going to test cranial nerve 1 olfactory. So could you just close your eyes for me, and then I'm just going to present something up by your nose and just tell me what you smell. And please include one lip, one nostril.
Alcohol.
Good. And now you can do the other eye.
Alcohol.
Great. Cranial nerve 1 is intact. Now we're going to move on to the mouth exam. I see that your lips are pink. They're not cracked, no lesions. Can you open your mouth for me? And tilt your head back a little bit. And can you stick out your tongue and move it side to side? Great. Cranial nerve 12, hypoglossal is intact. You can stick out your tongue again. Is it okay if I touch it?
Mm-hmm.
Just gonna look at the lateral borders. There's no leukoplakia or lesions. And can you stick your tongue out again? Great. So the tongue is pink, even. The dorsal surface is roughened, and can you lift it up for me? And the ventral surface is glossy. Now I'm just gonna check the buccal mucosa. Great, it is pink, no swelling. Great, pink, no swelling. And can you smile for me? Gums are no inflammation and pink. And can you open your mouth and say ah, ah? Cranial nerve 9, glossopharyngeal, and 10 vagus intact. And tonsils are +1, barely visible. So now we're going to move on to the eye examination. First, I'm going to start by inspecting. So I see your eyebrows are present bilateral, symmetric, they are evenly distributed. Your eyelashes are evenly distributed. Your eyelids are overlapping the iris. There's no swelling or discharge. Your eyeballs are not sunken in or protruding, and they are in the sockets. Just going to take my gloves off. And is it okay if I touch you?
Mm-hmm.
Can you just look up? I see that your sclera is white, and I see your tiny vessels. The conjunctiva is clear, and palpebral conjunctiva is pink. And I'm going to feel your lacrimal gland. Do you feel any pain?
No.
And there's no excessive tears or dryness in the puncta. And now I see that your iris is evenly colored and round, even, and your pupils are the same size and round on both. So we're just going to test cranial nerve number 2, optic. So I'm going to have you cover one eye with this opaque card. You can hold the Rosenbaum test in your hand, and I'm just going to ask you to read the you can do the third line.
8, 7, 4, 5.
Great. And visual acuity is normal. And now you can switch and read the same.
8, 7, 4, 5.
Great. Visual acuity is normal. 20/20 vision. That tested for functional vision and cranial nerve 2, optic intact. Sorry, wrong card. Now we're going to do another test called the confrontation test, also testing for cranial nerve number 2. So you actually don't need this. I'm going to stand in front of you, and you're going to cover an eye, so of your choosing. Okay, so I'm going to cover this eye, and you're just going to let me know when you see my hand.
I see it. I see it. I see it.
Great, and the other side.
I see it. I see it. I see it.
Great, cranial nerve number 2 intact. Your eyes moved upwards 50 degrees, 90 degrees temporally, 70 degrees inferiorly, and 60 degrees nasally. So now I'm going to test for cranial nerves number 3, 4, and 6. So I'm going to start with the corneal light reflex. So I'm just going to shine this in your eyes, and I see that the corneal light reflex is in the same spot on both eyes. Now we're going to do the cover test. So you can just hold this on an eye, and then you're just going to remove it. Great, no nystagmus or jumping. You can do it on the same eye. Great. No nystagmus or jumping. Now I'm going to do the 6 cardinal fields test. So I'm just going to stand in front of you, and you can keep your head focused. The only thing you're going to do is just move your eyes and follow my arm motions. Great, no lid lag or nystagmus. Cranial nerves 3, oculomotor 4, trochlear, and 6 abduction intact. So now I'm going to do the pupillary light reflex test. So I would darken the room and turn the lights off. I'm just going to come at an angle here. I saw direct and consensual light. And I'm going to do it on this eye too. I saw consensual and direct light reflex. So now I'm going to be doing the accommodation test. So you're just going to follow my finger here. Great, I saw both constriction and convergence. The pupils are equal, round, and reactive to light and accommodation. And once again, cranial nerves 3, 4, and 6 are intact. So now I'm going to use the ophthalmoscope. And I would darken the room. And I'm going to get pretty close, just to let you know. Red light reflex noted. Optic discs are creamy yellow-orange. No edema. Margins are crisp. And I see vessels, no hemorrhage. Now I'm just going to do the same on this eye. Red light reflex noted. Optic disc, creamy yellow-orange color. Margins are crisp and no edema. And no hemorrhage of vessels. Great. So that was the eye exam. Now we're going to move on to the last exam, which is the ears. So I'm just going to quickly do some hand hygiene. So first, I'm just going to start by inspecting. I see that your ears are present, bilaterally and symmetrical. First, I'm just going to start by inspecting them more. I see that there's no discharge, lesions, or any cracks or redness or swelling. This side, no lesions, swelling, or anything like that. Now I'm just going to use the otoscope, and I'm going to hold it like a pencil, and I'm going to inspect the inner canals. They're patent. I have no foreign bodies, cerebrum noted. The cone of light in this right ear is at 5 o'clock, and the tympanic membranes are pearly gray, shiny and translucent. Now I'm just going to come around. Thank you for turning your head. Sorry, I'm just going to put this back here. I'm just going to hold the pinna up and back. No foreign bodies noted. The canals are patent. Cerebrum noted. Tympanic membranes are pearly gray, shiny and translucent. And the cone of light in the left ear is at 7 o'clock. Now I'm going to test for cranial nerve 8, vestibulocochlear. So I'm just going to stand 2 to 3 feet behind you and whisper some words in your ears. So I'm going to start with this left side, so you can cover this ear. Sorry, you can cover the other ear. And I'm just going to whisper some words.
Coconut, red, butterfly.
Great. Cranial nerve 8 intact on left ear. Same thing on this side.
Dinosaur, 80, blue.
Great. Cranial nerve 8 vestibulocochlear intact on both ears. Now we're just going to move to some tests. So this is going to be called the Weber test. And I'm going to hold the tuning fork on top of your head and just let me know what sound, what ear you hear the sound in more.
I hear it in both.
Great. And now we're going to do the Renee test. So there's going to be 2 sounds you hear. What I want you to tell me is when you stop hearing each sound. On the mastoid bone.
I stopped hearing it.
Okay.
I stopped hearing it.
Great. Now I'm going to do this on this side. Same process. Mastoid bone.
I stopped hearing it. I stopped hearing it.
Great. Air conduction was twice as long as bone conduction. That concludes the end of the head, eyes, ears, nose, and throat exam. Do you have any questions for me?
No.
Great. Thank you so much, and I hope you have a good day.
Thank you.